Today we're here to talk about a new vaccination program that we're going to try to get off the ground in Fall River. It's already been going on for a little while, but it's something we really want to do to help the residents across the board in our city. But I do first off want to introduce the people that have joined us today for this very important announcement. This is his district, State Representative Alan Sylvia. Also another state representative from Fall River, Paul Schmidt, good friend. Real good friend, Father Rob. This is his church. We have our two chiefs with us, Fire Chief Lynch and our Police Chief Jeff Cardoza. Also joining us today is City Councilor Linda Pereira, also a good friend, who's also very committed to making sure all of the residents in Fall River are safe and protected with vaccines. We're going to have ample opportunities with this new program for everyone to get a vaccine at their convenience. We're going to work it very hard across the city, but we need all the residents to know that the vaccination is the way out of this pandemic. That's all I'm going to say today. I'm going to turn it over to our health director, another really good friend of mine, Tess Curran.
Thank you, Mayor, and thank you all for being here today at our clinic at the Blessed Trinity Church. Vaccines continue to be the most effective way for individuals in our community and the state of Massachusetts, or Commonwealth of Massachusetts, to protect themselves and their loved ones from COVID-19. And here in Fall River, we have a great team of community members working diligently as a unit to address vaccine hesitancy and expand opportunities for clinics, mobile opportunities here in Fall River. So today marks our second week of this new block-by-block vaccine strategy that we've implemented here. This initiative focuses on census block areas that have the lowest rates of vaccinations in the community. And we're targeting these areas with mobile clinics on evenings and on weekends in an effort to reduce barriers and provide residents with clinics in locations that they're familiar with and that are easily accessible to them. In addition to these clinics, we are pulling all of our outreach team members to target these areas in the days leading up to the clinics and during the clinics, so that individuals can have one-on-one conversations with multilingual outreach team members who are trained to address hesitancy and to address any concerns that those who are not currently vaccinated may have. Many of our outreach workers live or work in Fall River, and they're able to really target their messaging and make connections with the community in a way that we haven't really been able to do previously. So we feel as though this targeted outreach, block-by-block approach will help to increase the rates of vaccinations in these neighborhoods and the community at large. We are really grateful for the support of Blue Cross Blue Shield and the Field First team who's been handling logistics and spearheading this initiative. And also I would like to thank our community partners and the outreach teams that are doing that work. Sir Jobs for Progress, the Immigrants Assistance Center, Coalition for Social Justice, Healthcare for All, and again the members of our vaccine outreach team who are, again, working really diligently to address this hesitancy in the community. I'd also like to thank our community members, like Father Rob, for offering the space in the community, again, making things accessible and easy and familiar for people, not only for this block-by-block approach, but also in the months leading up to this, we've had clinics at all sorts of locations throughout the community and have been incredibly appreciative of that work and willingness to help. So if you haven't been vaccinated, now is the time. Again, the vaccines are safe, they're effective, and we are here to serve you and make it as easy as possible. Anybody who is 12 and up is currently eligible to receive the vaccine, and we want to make sure that people going back to school, going back to work, are protected and are getting the vaccine prior to going into those spaces. So we'll be here at Blessed Trinity today. We'll be moving to the Day of Portugal event this weekend. For dates and times, I would encourage everybody to visit the frvax.com website. that has the most up-to-date information in terms of clinic hours. It's searchable by vaccine type and age, so that's a great resource. Again, that's frvax.com, and that has the listing of all these block-by-block clinics, as well as other clinics that are put on by other community partners like STAR, South Coast, Health First, and the like. So, if anybody has any additional questions, community members can call the health department at 508-324-2410. And at this point in time, I'd like to pass it over to Helga De Rosa, who is the account executive of municipal markets for Blue Cross Blue Shield, who will kind of discuss their involvement in this program. And again, we're very appreciative of her work.
Good afternoon. We're excited to be here in Fall River today, a city where lots of our members and associates live and work. At Blue Cross, we're committed to bringing an end to this pandemic, and we do understand that vaccines are the best tools that we currently have to do that. So we're so excited to sponsor and be part of this unique community-focused approach to bring vaccines into the Fall River communities with the greatest needs. While Massachusetts is a national leader in vaccination rates, we do understand there are lots of barriers like convenience, vaccine sensitivity, cultural. So we want to be able to come into the community and help boost those vaccine access in high-need communities by leading this community-focused approach. So to do that, we've partnered with the CIC Health and the Commonwealth of Massachusetts and community leaders on innovative initiatives like this mobile clinic that helps break down those barriers and serve residents in the neighborhoods where they live, work, and play. In addition to improving access, Blue Cross is working on boosting vaccine confidence by producing and publishing video and written contents, such as PSAs. We also have videos featuring clinicians, testimonials from community leaders, faith leaders, prior COVID survivors, and former vaccine skeptics. So on behalf of Blue Cross Blue Shield and all others here today, I'd like to extend a thank you to all the residents of Fall River for welcoming us here, as well as to Mayor Coogan and his team for their strong relationship throughout this entire pandemic, and as well to CSA Health for their round-the-clock work on this. And a special thank you to Father Netkovich and all other important stakeholders here today, and I will turn it over to Father Rob now.
Good afternoon. Just want to welcome everyone here to Blessed Trinity. We're excited to have this vaccination clinic here. And just a word to those who aren't vaccinated. I know there's a lot of people that don't want to get vaccinated because they're concerned for themselves, but I'm going to ask you to think about your neighbor. Think about the person that's older that has existing health conditions. Think about the children, and think about the common good. Let's try and get this behind us, and the quickest way we can do that is if we all get vaccinated. So I ask you to please consider doing that. You're going to be here at Blessed Trinity today, the Day of Portugal, over the next few days, and they'll be back here next week. But please do consider that, and it's good to have you all with us.
Good afternoon, and thank you, of course, for being here. I missed a lot of what Tess had to say because every time a motorcycle went by on Plymouth Avenue, we sort of lost her. But I know this because I've been in communication with Tess and the mayor's office and my colleagues, State Rep Schmidt and Rep Viola, on this issue for months. And unfortunately, we see the numbers increasing. We see hospitalization increasing. Before I forget, I want to thank the Department of Public Health. I want to thank Blue Cross Blue Shield in cooperation with our mayor's office for doing this block by block. And they're not doing block by block because it looks good. It's been hot out there, and these medical professionals are out there waiting in the heat for someone to stop by. Not even half of the population of Fall River has been vaccinated. That's a sad situation because I just said numbers are increasing and hospitalization is increasing. So please, there's lots of false information out there. Talk to your healthcare provider. It's what we always say. Talk to your physician to see what they think. But you're really placing your life at risk. So the life you save may be your own. So please, as you pass by the block-by-block stations, please stop by. Thanks.
Well, you're right, Representative Sylvia, that this is a matter of life and death for us. And we're both here to compliment the mayor and support him on this effort. We've got to overcome the hesitancy And as Father, as you were saying, don't do this just for yourself. Do it for your community, your street, your block, and for goodness sake, and for the rest of your family. Do it for your grandparents. Do it for your children. Get vaccinated. So that's our message here today. Thank you to the mayor. Thank you to our partners at Cataldo and Blue Cross. Thank you very much for everybody who's listening. Spread the word.
That wraps it up. Thank you, everybody.